everyone. So now in this lecture we are going to study about the next important aspect after we learnt about the impression making procedures and the theories, right? This next important step in fabrication of complete dentures, when we are done with our final impressions and we have our master cast with us, right? So now in that case we need to do what? We need to record the relationship of the maxillary and mandibular jaws. The next step is jaw relation procedure, right? So before we understand the various types of jaw relationships, it is very much important to understand the movements of our bone. The only bone which is movable over here is your mandible, right? It's a highly mobile bone. Apart from your whole stomatognathic system, mandible has a varied range of movements, right? And these movements are complex movements, okay? They are not something which are very simple. So the prosthesis or the complete denture which you guys are fabricating should be in harmony with these movements of the mandible of your respective patient. Every patient will have different range and different type of movements in different planes, and you need to understand those movements, and then only you can harmonize the movements with your prosthesis. So firstly, if I want to broadly divide the movements of mandible, I can divide it as two: functional movements and parafunctional movements. What do you mean by functional movements? The movements which the patient is going to use to carry out the functional activities is called as functional movements. That can be like mastication, speech, yawning, right? All those movements will be considered as your functional movements. Any unnatural, non-characteristic movements like clenching of the teeth, tapping of the teeth, grinding of the teeth, right? All those movements are unconventional movements which are not going to help us in a functional way. Okay, so mainly two types of movements: the functional movements as well as the parafunctional movements. Now after this broader division, I want you all to understand the determinants of mandibular movements. Now what do you understand when I say determinants of mandibular movement? So when I am saying determinants, that means there are certain structures which are present in our mandible or in the TMJ or in the stomatognathic system, which are going to determine the movements of mandible. First is your condylar guidance. Okay, so suppose this is the condyle. I'm drawing a mandible with a glenoid fossa. Okay, so condylar guidance, this is your condyle. Anything which is going to guide the condyle is known as condylar guidance. So the slopes of your articular eminences, these are the slopes of your articular eminence, that is in your maxilla, the glenoid fossa, right? So the slopes of the articular eminence are going to help in guiding the mandible for its movement, right? Second is the incisal guidance. So if I draw over here, so your maxillary incisor, this is your mandibular incisor, right? So the plane formed by the relationship of the maxillary and mandibular incisors, the condylar guidance, and thirdly is the neuromuscular factors, the nervous system associated with these factors, right? So these three are very important when we talk about the mandibular movements. These are considered as the determinants of mandibular movement. So if I want to define the condylar guidance, it is, you can just mention that mandibular guidance which is generated by the condyle, right? By the condyle and the articular disc. We have articular disc also present between our in the temporomandibular joint, which is traversing or passing through the contours of glenoid fossa. Okay, so any mandibular guidance which is generated by the condyle as well as the articular disc which is traversing through the contours of glenoid fossa. So in short, anything which guides the condyle to traverse or to pass down to cause the mandibular movements is a mandibular or condylar guidance. This usually slope is S-shaped slope, right? So the movement which the mandible will generate also will be an S-shaped movement, right? The angle formed by this plane is called the condylar guidance angle. Horizontal condylar guidance. It is called as horizontal condylar guidance. The angle formed by the traversing condyle in relation to the horizontal plane is called as horizontal condylar guidance. So suppose I will just represent with a mandible model. Suppose, sorry. Yeah, so imagine this is your glenoid fossa, the silver thing if you can see. Now this is the condyle, right? Now when the mandible is passing through this slope, okay, when the mandible is passing through this slope in and out, right, this slope formed by the inner surface of the glenoid fossa is your condylar guidance. It has a specific angle through which it is located or it is anatomically oriented. So suppose if I place it like this, it has a specific angle, so mandible has to travel with this angle downward forward. Okay, so this is in simple terms what we call as condylar guidance. Similarly, your incisal teeth, right, maxillary teeth and mandibular teeth, the lingual slopes or the palatal slopes of your maxillary teeth with the labial surface of lower teeth, when they slide, this also forms a guidance in the incisor region, that is called as incisal guidance. And again the third factor, that is your neuromuscular factors, right? So these are the three main determinants of your mandibular movements. Now if you want to classify the mandibular movement, right, so when we want to classify the mandibular movement, it is based on the dimension of the movement, based on the type of movement, based on the extent of the movement, right? Based on the dimension of movement, based on the type of movement, and based on the extent of movement. When I talk about dimension, that means in which dimension that movement is occurring. Okay, so firstly, based on the dimension of movement, we have rotation around transverse or hinge axis. Then secondly, you have rotation around anteroposterior or sagittal axis, and rotation around vertical axis. Combining all these three, we have included the fourth dimension, right? Fourth dimension here is time. So in relation to time, what is the movement of mandible in 1 second, in 2 seconds, at a third second? So translation in time is a fourth dimension which is added, right? And that is also considered when we are discussing about the mandibular movements. Every person will have a different anatomy of glenoid fossa. Every person will have a different anatomically structured mandible. Okay, all the people have some or the other variations. That is why it is important to study the dimensions individually, right?